what happens during the aging process, sometimes it's very easy to check because, for example, in France, we have our driver license with our photo from the beginning, from our 18. So this could be, as Philippe told you, a little bit, difficult. And like me, you are not like me, you are shocked. You are shocked by what happens during your aging process. And we thought at the beginning, when we started to study the aging process, that the face was like a butter mass. I cook, so I can say it's a very good butter mass here. But the face is not like that. Face is like a puzzle. And this is very important for you to know that it is a puzzle. The third theory was a surgical theory. It was a gravity. When you receive the apple on the head, we know that there is a gravity on Earth. And this is why we treat this gravity with a facelift. But this theory was not really the good one, because Valendros in 2008 showed that under the eyelid, there is no movement. It's a stable position. So you see, in some part of the face it's mobile, in another part it's not. So there is a new theory, a deflation theory. It means, like this woman here, you lose fat during your aging process. But is it true? No. Two publications, recent publications, published on illusion of volume loss. It means that you lose in some part of your face and you gain in some other. So this is what you can understand from the aging process. So if we can go from the bone to all the layers, that we have in our face, what happens? The theory for bone, we lose bone. Is it true? Like we can see here, on the lateral part, you see the movement of the bone during the aging process. You push forward, the supraorbital ring, and you will increase this area. And if you are looking to the lower part of the face, your mandible, like Philippe showed you, push forwards, and your chin is going forwards. So you see, for the bone, you lose bone in some part, but you have deposition of bone in another part. So you will have to deal with this. And this is the aging process, for example, around the eyelids, where you see an old skull and a young skull. So you have a big modification of the skull that is the base of your face. If we go to muscles, a lot of people here will say, oh, I'm going to be older, not me, you, and I lose some muscles. Is it true? Muscles become weaker or muscles become stronger? I'll give you 3 examples of that. Look, platysma. Do you know what happens with the aging process? We published in 2017 this article with Gisela Criollo, and we demonstrate that platysma bands, it's not a laxity, it's an hyperactivity of your muscle. And the skin follows the platysma bands and not the opposite. So, platysma becomes stronger with age. Look, this is a facial palsy. On the palsy side, no more issue in the neck. On the non-palsy side, you see the platysma bands. Same for this guy. 10 years between these 2 photos of my patients. So you see the neck on the palsy side is almost normal. Another study, the eyebrow. Frontalis is become stronger or weaker? Look, this is Valendros' study. I love this guy. He did a photographic study on 130 patients, and he follows his patient on photo with 25 years between 2 photos. And he's looking to the eyelid. In 29% of the cases, like you, it's coming to be lower. This is what you think, that the eyelid is coming lower, the eyebrow is coming lower with the age. But he discovered that eyelid is stable in 41% of the cases, clinical cases, and 28% of the eyebrow is going to be higher. So it means the frontalis, contract more with the aging process than before. So there is an hyperactivity. And what you can say when you see this, the bruxism. Sometimes you have a bruxism. Why? It's because your muscle, your masseter muscle, become stronger. So you see, it's not so clear. So bone is not so clear. Muscle is not so clear. And fat. Does the fat increase or decrease? Look at the superficial fat compartment for the midface. When you are looking to this patient with the aging process, and you check, the 4 superficial fat compartments she gets, you will see that if you are close to this fat compartment, with the aging process, 3 decrease and 1 increase with age. The one that is above your nasolabial fold. This is why you increase the nasolabial fold. And if you are going to the deep fat compartment, the 3, the 2 SUVs and the deep medialgic fat compartment, all these fat compartments decrease with age. So you see, it's a puzzle, this fat. And look at this woman. She loses fat. But look at this other woman. She loses fat, but she gains fat here with the aging process. So look, it's not so simple also, the fat. So bone is so simple, muscle is so simple, fat is so simple, and it's for that, with fillers, this is one of my cases, you can really improve the face of somebody with fillers. And for the skin, everybody here will say, oh, my skin has become thinner with age. Is it true? Look, there is some article published, histologic studies that show that the skin becomes thinner. And also, with echo study, you see that the echogenicity of the skin increases with age. Why? We don't know. If you do an MRI, you have a decrease of the thickness. But if you are looking to a review of all the articles published on skin, look the conclusion. Difficult to interpret. So it means that it's very difficult to know what happens to your skin during your aging process, depending on the area where is the aging process. So in conclusion, you see that regarding the expert, it's not so easy to explain really well what happens during your aging process, because the aging process is very, individual. So it's important to check with your patient to see what happens. And we will see with Tracy that this is very important to have a very good patient assessment. But before, I will ask Philip to go back on the stage.